We saw during COVID how much pharmacy can do.
When vaccines first hit the market and pharmacists gave them, everybody was like, why would you go to a pharmacist for a vaccine? They all went to their doctor.
Pharmacists delivered over 300 million COVID vaccinations during that time, by far more than any other healthcare provider.
Independent community pharmacies were there in a crisis, and we were nimble and able to take care of our communities.
You know, they're doing immunizations,
contraceptives,
tobacco cessation,
UTIs or burns or shingles.
You know, I really didn't realize
disease state management,
HIV prevention.
that pharmacists
on and on and on.
could do so much.
There might not be pharmacies in 5 years in our neighborhoods anymore. And it's because the profession's changing, but the general public awareness hasn't been changing yet too.
Independent pharmacy is in some crossroads, let's just say. You know, the more prescriptions we're filling right now, the less money we're making. The PBMs have backed us into corners that are unfathomable.
They're told one price, then the rules change on them where PBMs reach in and say, no, we've changed the rules on how we're going to reimburse you, and they actually reimburse them less than they were paid at the counter for it. These DIR fees are killing our rural pharmacies.
There's a lot of problems in our industry because the big insurance companies have decided that they don't want to pay pharmacies fairly for the dispensing of prescriptions. And oh, by the way, these big insurance companies own their own pharmacies. They want to kill their competition, kill the independent pharmacies, put them out of business.
We've kind of been forced by reimbursement barriers to look at the fact that we can do more than just dispense medications. We can get paid for doing more.
We know as pharmacists that we have the training and the expertise to be able to take care of our patients. Hi, I'm Michelle Belcher. I'm a second-generation pharmacist and owner of Grants Pass Pharmacy. So my dad found it really important to offer services to his patients that the community didn't have access to at other pharmacies. I've also wanted to continue that same service to our community through advanced clinical services.
I was given the opportunity to actually sit down with her and go over my extensive list of medications. It's the first time that's happened to me in a pharmacy. I felt taken care of. I felt safe.
So the first part of our appointment was sitting down and getting to know Peaches.
Normally, when I meet somebody new in the medical field, I have a lot of apprehension. And she walked in with a warm smile, not trying to get all the thing fixed in 5 minutes. She took a lot of time with me.
When someone comes in and talks about a medication that they're hoping to get off, and we can sit down and talk about that medication, talk about what their goals are, talk about what their conditions are. And if there's an opportunity where I can bring in their provider, prescriber, and have a discussion with them about that, we can make a plan.
As much as pharmacists love our patients, we can't provide services for free.
Oregon lawmakers just approved a bill to allow pharmacists to hand over birth control pills without a doctor's prescription.
At All Care Health, we felt that it was really important to recognize that our pharmacists are providers in the community and to try and not just promote it, but make sure that it was sustainable. In our company, we worked hard to create systems that allowed for pharmacists to come in through medical claims, to bill for office visits when appropriate, to bill for clinical services.
With so many other states that don't have this status yet, they are looking to us to kind of pave the way and show the benefit to the patients and to their communities.
Tens of
thousands of Oregonians are now having to travel farther to get the medications they need.
Yeah, we're talking about those in rural areas where local pharmacies have shut down increasingly over the last few years.
I've been with the same pharmacy, but when Safeway shut them down, it was a disaster. I live, 16 miles up a mountain.
Oregon has the second worst access to pharmacy services in the country, and the only state that we trail is Alaska. A lot of times, pharmacies, especially in the rural areas, are the only point of care for a patient. So being able to have a pharmacy offer those clinical services right there, because they are the most accessible form of healthcare.
Pharmacies play this critical role in that they're in your local communities. Doctor's offices are booked out in a lot of the rural areas, especially like in Myrtle Creek and Douglas County. If I was a patient and I had some of these things that I'm looking to get better, like my diabetes or my hypertension, or I want to think about stopping smoking, I think my first step would be to go into the pharmacist. I bet you they have answers, one way or the other. Hi, I'm Tyler Deering. I'm the new owner of Myrtle Drugs in Myrtle Creek, Oregon. I'm the pharmacist, pharmacy manager, pharmacy owner, pharmacy friend.
Well, I've been smoking for 53 years, and I have COPD. It's a do or die kind of thing.
She asked me if, how can she stop smoking after 53 years? I said, let's talk, let's do stuff. Let's look at different options for you. What have you tried? Tobacco cessation is really just a fancy word for quit classes. And so these are classes designed to help you quit smoking or vaping or other nicotine products. One thing that I struggle with in my programs is we can't provide NRT. I can give them training and education. That's really where I'm limited. Whereas Tyler, he's able to prescribe those drugs. He's able to communicate with these patients and see them regularly, much more than I can. In fact, they're probably there more often than you see your doctor. You see them, maybe once a year? You might see your pharmacist every single month. But I think it's the initial conversation, the initial willingness to stop, and then, the connection you make, we're friends.
He's the best. He helps me. Well, if this ain't working, let's try this. Right now, we're trying to gum, see what we can come up with. Get my husband off my back.
Lives are at stake when you don't have pharmacies in an area where you can get to easily. So, being able to provide these services is all that much more rewarding.
So we're kind of at a critical time when we have done all the preparation to be ready to stand up and take care of our patients.
We need more patients. We need more consumers walking in to kind of get us in the flow. And that is one thing that happened with COVID.
When there was a shortage of places to go for care, they came to pharmacy because pharmacists are providers.
I see that continuing to gain momentum and expand much more quickly over the next 5 to 10 years.
I hope one day that we can get to a point where patients see their pharmacist as their healthcare provider.
That they're not just selling you a product, but they're looking at what's changed, what needs to change, what could change, what's coming around the corner.
That will really transform public health for our communities and our nation.